Hello, I chose solution focused therapy. My client's name is Hana. She is a Korean American woman in her 50s who has sought out counseling for anxiety and depression that's gotten a lot worse in the last few months. So she works as a nurse and she has for the last 20 years. But recently she's had a lot of anxiety on the job. She's worried about accidentally hurting a patient. And in addition to that, she's been depressed. She's been sleeping a lot, not doing the things that she enjoys as much. So she's sought out counseling to address that. She lives with her husband and she has a son, but he recently moved away to college. So she still talks to him, but he doesn't live with her anymore. And so my thought is that this is the second session. The first session I figure was probably rapport building, informed consent, talking about my therapeutic style. And this session is more, we both know each other. So for this session, we're going to move into some solution-focused interventions. Hi, Hana. It's good to see you again.
Hi, yeah, it's good to see you too.
So how has your week been since I saw you last?
It's been, I don't know, it's been a little off. Kind of the same, but it just feels like every day feels weird. I feel anxious at work. Things, I don't know. I'm not acting the way I want to act, but I just feel weird.
Yeah, so things feel weird, you feel off, anxious, you're not acting the way that you normally do, the way that you want to act. Is that right? Yeah.
Yeah, I'm just down all the time. I don't know. I don't know what's going on or what to do. I don't feel like doing anything.
Yeah. So how long have you been feeling this way? Like you don't want to do anything, like you're really down. And how long has it been going on?
It feels like forever.
Well, if you had to put like a date on it when it started, about.
I mean, my husband said that it's been a few months, but so I probably like 2 or 3 months.
Okay. So for 2 or 3 months, you've been feeling off and down and anxious. Sounds really rough. Are there any times when you're not feeling this way, when you feel like you're acting like you want to act and you're not feeling off, you're not feeling down?
Yeah, sometimes when I talk to my son on the phone, it feels good. He makes me feel better, or I feel like when we hang up, or by the end of the conversation, I feel better.
Yeah.
Or I forget that I'm feeling weird.
Mm-hmm.
And then sometimes when I'm hanging out or spending time with some of my friends, like when we go to the movies or if they invite me over for dinner or something, like when I feel distracted.
Yeah. So it sounds like when you're in social situations or talking to your son, the problem, you forget about the problem. It doesn't feel like it's there anymore.
Yeah.
When you're doing those things.
Until I go home, and then it feels weird again. Well, sometimes when I get home, I guess I'm so tired, I just go to sleep or something, or maybe if it was really good, then that's a good night. But then when I try to fall asleep, it comes back, that feeling of weird, or when I wake up in the morning, it feels weird. Yeah. So it doesn't last very long.
Okay, so the feeling goes away, the weird feeling, but it's only during those interactions or those activities. Okay. Can I ask you kind of an odd question? It
Okay.
might take a little bit of imagination.
Okay.
Okay. So I want you to imagine a normal day. Like a normal day, you go to work, you come home. Let's say, does your husband make dinner, or would you get takeout? What would be the norm?
Lately, my husband cooks or we get takeout.
Okay, so let's say you get takeout. You eat dinner with your husband, you chat. Maybe you clean up the dishes, and then what do you do right before bed? Do you read a book or?
I usually look at my phone. I look on Facebook and sometimes,
Yeah.
just look at Facebook.
So you do your normal things. You look at your phone, and then you go to sleep. And then you wake up in the morning, and a miracle has happened. So the miracle is that the problems that brought you to therapy, so the feelings of weirdness, the anxiety, feeling down, all of those problems are gone. But no one has told you that. So my question is, what happens on this miracle day? How do you know that the problems are gone? How do you know that you're not feeling weird anymore?
I think I would wake up and I would see my husband next to me who's awake and we smile at each other. And then I would go to the kitchen and make some breakfast. And I wouldn't feel anxious or weird.
How would you know that you weren't feeling anxious or weird? What would be the things that you would observe?
I would be making plans. Like I would feel energy. Like I want to call my friends and make some plans for the day. Yeah, I would be excited to do things.
Yeah.
So then maybe I would call them and then and then we could go to the movies and then maybe we all meet up with our partners for lunch together. We have lunch, we all spend time, and then I can call my son, and we have a good conversation, and then...
How would you know it was a good conversation? What would it be like?
I would ask him questions about him instead of complaining about how badly I'm feeling. I think we would laugh. We would laugh a lot or smile. He would share things with me. Maybe we could, I could tell him I miss him. And then around dinner time, my husband and I can cook together and maybe eat on the patio and watch the sunset.
Well, that sounds like a really lovely day. So from that, it sounds to me like you have some really clear ideas about what your life would look like if these problems were gone. So just to kind of set some guidelines for our counseling going forward, let's say that the moment that you decided to seek help, like the moment you called me to make a session, let's say that was a 0. And then let's say your miracle day, that's you at 10.
Okay.
So having that scale in mind, 0 to 10, where would you say you're at today?
Today I feel like I'm at a 4.
And how do you know you're at a 4?
I don't feel energy to do anything. I feel like it was hard to motivate myself to come here, and I feel, I don't know, nothing feels good.
Yeah. So, if you were at, let's say, a 5, what do you think you would do after the session if you were at a 5?
I would go home, maybe stop at the grocery store, and cook a nice dinner.
Okay. Mm-hmm. Well, does a 5 sound like a realistic point that we could maybe get you at this week?
I don't know.
If it sounds a little too far, we can say 4.5. What do you think?
I want to be at a 5.
Right, of course. But if that sounds like too much, we can scale it back a little bit. So what do you think?
Okay. Let's try a 4.5.
Okay. So, let's say, I want to set sort of like an achievable goal, well, together.
Mm-hmm.
Would going home and making dinner one night this week, does that sound like something achievable for you?
Yeah, I could do that.
Okay. All right. So one night this week, go home, you'll make dinner, and then just try to think about how you're feeling during that. Are you still at 4? Are you at a 4.5? And next week we can talk about it and see where to go from there.
Okay.
To answer the first question, why did I choose solution-focused therapy for my role play? I chose to try this one out because I like that it has really concrete methods and interventions to use within the approach. I think it's nice as both a clinician and a client to have those things to hold on to within the therapy and not kind of feel like you're just floating around. There are very clear goals and clear ways to get there. I like the optimism and the hope that's in it, that as clinicians, we assume that people can get better and that they can help themselves with just a little bit of guidance. I think solution-focused theory influenced both the way that I interacted with the client as well as what was actually said and the interventions that I used. In the way that I interacted, I tried to embody the empathy and the warmth as well as like the optimism and the hope. It also influenced just like the information gathering, because within this theory, you want to get a lot of information so you can tailor the interventions to that specific person and tailor the goals and the homework. So asking her, like, how long have you been feeling, in her words, weird and not right? And in what cases do you not feel this way? Figuring out exceptions is really important. And then, of course, using the miracle question and the scaling questions. If I were using person-centered therapy instead of solution-focused therapy, I think it would look very similar, but would also differ in a lot of key ways. Solution-focused is really heavily influenced by Carl Rogers, but it does take it in a different direction. So if I were doing just person-centered, then I would have done a lot more of what I did in the beginning of the session. So just listening, reflecting back, just trying to be a warm, empathetic presence, and just letting that be the vehicle of change. In terms of multicultural considerations, my client was a Korean American woman, and this was part of why I chose solution-focused therapy. According to Gayheart, this form of therapy works really well with Asian Americans because it doesn't ask clients to talk about their emotions in really explicit ways that might be uncomfortable for people of certain cultures. And like I said before, this approach doesn't impose any assumptions about mental health onto the client. It just works with people where they're at, which works really well with people coming from different cultures who might have different norms on mental health and emotional well-being. Strengths of this approach are its applicability to a wide range of people from different cultures. The brief timeline makes it more financially accessible, and the concrete interventions I think are nice for people, gives them something sort of concrete to grasp onto, and also helps people stay hopeful and optimistic. They can see that an end is in sight. Some drawbacks are that solution focused counselors typically don't look at the wider societal lens that like narrative focused therapists look at, so they could be missing something really crucial. They also don't look into people's past, so they don't look at like the reasons why someone is feeling the way that they are, and I think this could be frustrating for certain people. Lastly, how could music therapy be incorporated into solution focused therapy? I think that you could do it in a few different ways. Music making could definitely be part of the goal setting, either music making in the session with the therapist or music making outside of the session, depending on the client. So, like if somebody had social anxiety, maybe a goal could be to make music with the therapist to engage with them in that way for 5 minutes during the session, and then 10 minutes, and then 15 minutes. And then you could ask where they are on their scale throughout that, before they did the music, and then afterwards, see how it's making them feel. I also think there's a lot of opportunities for songwriting in this approach. You could help clients write a song about what it feels like when they're on a 0 on their scale, and then in comparison to that, a song about their miracle day. And you could even like record the Miracle Day song and give it to the client, and then they could have that as a source of hope and inspiration that could maybe help propel them forward.